The point is that the cheap expertise of big data and AI is coming to health and healthcare, and this is going to change clinical practice. And especially, it's going to shift more of health and health research away from traditional healthcare. We think of traditional healthcare as being traditionally the center of health, but it has only been that way for about the last 150 years. It may turn out to be an aberration. And if we want to do research, we're going to have to look not only within the healthcare system. Back to Clayton Christensen, as we kind of come full circle to where we started. Clayton Christensen wrote a second book about the healthcare system in particular and said, the way that we're going to get growth and affordability in health is by embodying expertise in devices and equipment. And he wrote this even before AI was all over the world, was all over the news. So pretty impressive that he came up with that. Well, what was he talking about? Where is the data for our health? I'll tell you a story about health data, and stop me if you've seen this story before. But back in 2000, almost all health data was on paper, right? Was in non-electronic health records. There's a little tiny red dot there that represents electronic health records. In the United States, we had a little tiny, even tinier dot that represented consumer health IT. Back in 2009, the US government gave about $35 billion to hospitals to get them to upgrade to, well, I'm going to put upgrade in quotes, to upgrade to our absolutely horrific electronic health record systems that we use in the United States, and everyone thought, fantastic, now we can actually work on electronic health data, which of course is in the hospitals, in the EHRs, but I think I don't have to give you a hint to know exactly what happened and which of these circles got bigger faster. That's right, the consumer health side, right? Because of the rise of the smartphone, because of the rise of big data, most data about people's health is present outside of the healthcare system. And that might be in things like fitness trackers, which people tend to scoff at. But I was talking to a group of orthopedic surgeons, and they said, well, what can we do with this? And I said, 10 years ago, every one of your patients, I mean, your orthopedic surgeons, 10 years ago, every one of your patients started carrying a device around with them that they bought themselves with their own money that tracks how much they move and how far and in what direction every minute of every day. And you're asking me, what can you do research-wise with this? I mean, if orthopedic surgeons can't figure out what to do with it, I think the rest of us, you know, we just won't be able to. But the point is that all of this stuff, not just things like grocery trackers and fitness trackers and health admin and reminding you to take your pills and all the rest of that, but certain stuff like we were just talking about, like that ResApp thing where it listens to the child's breathing, that it's pulling out of the healthcare system, like the diabetic diagnosis. I expect that that diabetic retinopathy machine is going to be present in chemist shops by the end of the decade. Right? You won't even need to go to a doctor at all. Now, until recently, people thought all this stuff, the problem was we have to figure out how to get all this data from outside the healthcare system and bring it into the healthcare system and connect it to the EHR. Because, of course, the EHR is the center of the health data universe. And why would the EHR be the center of the health data universe? Because that is what doctors look at. Doctors look at the EHR. And doctors, with their very big brains, are the only way, right? Doctors with those big brains are the only way that we can take health data inputs and turn them into health data outputs, right? That's the only way until recently we were able to do that. But as we've been learning, that's no longer the case, right? It's not just AI, it's also pharmacists. It's also people looking at Google. We now have lots of different ways. It's taking prescription medicines and making them not require prescriptions anymore. We're in the process of a long-term trend to move things away from requiring a doctor to make a diagnosis for us to act. And so I think trying to move all this health data into the EHR is really a question of looking at the dog and looking at the tail and misidentifying which is which. The fact is consumer data, consumer health data specifically, is the dog. The EHR, the data we have in the hospital, is the tail.